Much like COVID-19, racism is a public health crisis. Although difficult, it's time to address the issue. In this PWT Healthcare Town Hall series, members discuss the social impact of racism in healthcare.
So similarly to Dr. Love, my experience with racism as a medical student and trainee, fortunately, was not as intense as other people, because I went to Morehouse School of Medicine for both residency and for medical school. So like those who trained at Howard, we were fortunately buffered in some ways. But what we did is have a role rotation. So you're talking about Metro Atlanta, primarily a large, diverse patient population, and then having to be shuttled to rural Georgia for a month of a rural rotation. And so that for me was transformative, eye-opening. I grew up in the Northeast. I moved to Atlanta for medical school. And when I arrived in central Georgia, I was blown away by, obviously there were kind people everywhere, but my first experience with actually a similar situation where someone called me the N-word. And I think this person really thought it was not a pejorative, like it wasn't a bad thing, was when I went into a patient room in one of the clinics there. I'm introducing myself to a grandmother and her grandchild, and I'm here to take care of your granddaughter, in exchange. She sort of looks me up and down and she says, "Where's the real doctor?" And so then, I pause. Obviously, I'm a guest, I'm a resident training in this clinic, so this is not my home clinic. And so I had the attending come in. I was, talking to her about the situation. I think this woman has an issue. I'm not really sure what it is. At this point, I wasn't clear what the issue was. So then she had a long-standing relationship with this grandmother and knew this family well. And while I was in the room, she tells this attending, "I don't want this nigger doctor taking care of my child." And it wasn't even like she said it with like a disgusted look in her face. It was just like, "I just don't want this nigger doctor taking care of my child. We're not here to be experimented on." And I don't know if it was the residency piece, which I doubt. At that point, you're sitting there trying to figure out, because it's an aggression, but it's sort of a microaggression at the same time. But the N-word just made it very clear, right? And so unlike what happened to you, Dr. Love, this attending really didn't address it. Unfortunately, this was an attending who was Caucasian, who had a long-standing relationship in this very small community with this particular grandmother, and so asked me to excuse myself from the room. And it was absolutely devastating, and it was disturbing, and it still stays with me to this day. And it kind of segues to what you were saying, Dr. Jackson, about the importance of having allies. I think that as we move forward, we really need to help our colleagues understand their role in changing the dynamic, right? So yeah, that's what sticks out to me. Microaggressions, aggressions, what is everybody's role? And I only wish that this person had been as diplomatic as the case that happened with Dr. Love. For me, it was, I literally wanted to leave the clinic and just run back to Atlanta. I did. So.
Oh my God, I hate you had to go through that. That is awful.
It was awful.
One word.
It was awful.
Definitely in a role where you're in training, whether it's medical student, resident, or whatever, even as attending, but definitely as a resident where your team and your attendings are supposed to have your back. It just leaves you exposed. You just feel like, who has my back? Who's supporting me? And it validates that patient's behavior. That's what I think sometimes persons don't realize. And it's one of those things. I had an interview in high school, was salutatory, valedictorian, all that stuff back then, right? And they were like, "What is one of your favorite quotes?" And basically mine was, "All it takes for evil to prevail is for good to do nothing." And what I think persons don't realize is inaction is an action. Inaction is a choice. So it's as we're discussing the social impact of, racism in healthcare, even if you feel like that doesn't bother me, that's not my issue, I don't really get it. Most people seem to do pretty good. Y'all are okay. Y'all are doctors now. The fact of the matter is, not taking action is an action, and that action does have consequences. And those consequences are detrimental, because let's say Dr. Virgil is like, "You know what? I'm not going to take this. I'm not going to be in this community. I'm not going to take care of you or your kids." Well, we already know there's a lack of pediatricians. There's a lack of primary care physicians. There's a lack of specialists in a lot of these rural areas. And so by not basically addressing that issue and saying, "Hey, that's not how we talk to people. That's not cool. We're not going to tolerate this behavior," they lose a physician. And the impact of that can be devastating for that person, because if you don't have a pediatrician to take care of your kids, where you say you don't want this in doctor to take care of your children, you may have no doctor to take care of your children. And the consequences of that could be you lose your child. So it's one of those things, like you say, it's definitely important for us to have a voice, but also to have those persons that support us. And like I said, I hate you had to go through that. And I know that other of our, brothers and sisters in medicine have had that experience and have had the opportunity for a person to stand up for them. And unfortunately, they didn't. We're thankful for those cases like with Dr. Love they have, or at least, you can tell, and you get energy from that, and you feel, protected and supported when you can tell those persons are having your back, and they're, like, whoa, what are you doing? We're not going to accept this. And that checks the person. But when you have it unchecked, that's when that person feels validating what they said. And in most cases, bad behavior doesn't stay the same. It gets worse. So, the next time it's, verbal, and the next time it may be physical, and the next time it may be the Yelp reviews or, health grade. And the next time it's, and it's on and on. And we already know with the loss of physician lives, with suicide, and the loss of people to practice, which is burnout and things like that. One of the major reasons, particularly for persons of color, is racism. And not feeling supported by the institutions and the organizations and the persons that should be supporting them. Dr. Elliott.
I was born in the District of Columbia. I was raised in Maryland. We call it the DMV, the District, Maryland, Virginia area. It's a very unique space in the universe. There's a lot of African Americans doing things. Prince George's County, which is adjacent to the District of Columbia, has the largest collection of middle-income African Americans in the United States. So racism isn't as overt. It comes off as being very subtle. And sometimes you get exposed to it as the byproduct of it. My experience with racism is sort of these microaggressions. One of the things I jokingly say, and I say it as a joke, but I don't really mean it as a joke, is that we're tired of this sustained high intensity trauma. And if you were to make that an acronym, we're tired of this X. And so, it pretty much applies to everything that we're going through. And I could give you story upon story upon story of these minor things that happen. One of the sad ones was I was a fourth-year resident at Georgetown Hospital, University Hospital. There was an African-American woman who was in the emergency room it must have been around 11 o'clock at night. And I walked into the room, and usually, the fourth-year resident is not always going to be the first one that's going to take that call in the emergency room, especially when it's a slow night. And I walked in, and the woman, an African-American woman, looked at me and said, after I introduced myself, said, "No disrespect, but I want the white physician." And I said, "Absolutely, my pleasure." And I walked right out the room. I went to the first-year resident. And I said, "Here's what you're going to do. You're going to go in and you're going to get a history. And when you're done, come back out. And when you're done, we're both going to walk in that room and you're going to present that history to me. I'm going to tell you what you need to do, and you're going to turn to her and tell her what's going to go down." And so she, it wasn't a matter of learning her lesson that day, but what it was is that we have been, I guess, brainwashed. There's so many of us that are tired. We're tired of fighting, and we've just relented and just become a product of this system. And so, that's just one of the stories as a byproduct. Or me going into a pharmacy, not even in the hospital. And, I was in street clothes, and there was a concern. It was the person at the register. And I said, well, she said there was something wrong with the prescription. And she said, well, let me call the doctor. I said, I am the doctor. She's like, you don't look like a doctor. And I just looked at her and said, what's a doctor supposed to look like? And, I am not 6'10". I am not, 2% body fat. I'm about 6 feet, almost 6'1". So obviously I don't come off as a diminutive person when I say, what does a doctor look like? I do that intentionally to make it blatant. I have had situations on a professional level where the assumption is made that, like many of us, the assumption is made that I can't possibly be the one that's in charge. I can't possibly be the one that's going to be the ultimate up or down say-so. And I have such a sarcastic sense of humor. I like sitting in the background, letting people dig that pit, and let them step right in it, and then just wait for them, and then see that and stammer to get out of it, because I love that stuff. I mean, that to me it's a wonderful thing. It's not my job to teach a grown adult how to treat other people like human beings, but I damn sure am going to make you feel small when you don't treat me like a person. And so I would say my experience has been these subtle microaggressions where people just they don't get it. Even residents. Now, I could be a fourth year resident, and there might be somebody that's below me in terms of year wise who's not African American. Because for 3 of the 4 years, I was the only African American male in my program, and I had a lot of great people that I worked with. And so I've worked with some wonderful people, and they're like siblings at this point in my life. But it's a clear sign that they're not used to coming in, especially in the District of Columbia. They're not used to coming into this space. And the last thing I will say is that as a resident, when you're doing a pelvic exam on a woman in labor, and there is a white male who sees a black male doing a pelvic exam, you would swear that this person was a graduate of Bob Jones University and they were about to lose their mind. And so it's just, for me, it's a matter of saying, I belong here. Are you going to say something? Because please do. Because I'm ready for that conversation.
Wow. I mean, you bring up so many points, Dr. Elliott. One of the ones, and Dr. Curry kind of put it in the phrase, right? Internalized racism. And this is something that I think a lot of persons of color sometimes don't realize as well, that the narrative you've been fed, right? From birth to whatever age you are now, is a narrative is the history, right? HIS in capital letters, history. And so of course the person that gets to tell that history can bias it and color it however they want. And when you have this overall years of just being fed this, like, you're less than, you're not as good as, you're not as important, you know, whatever. It's in TVs, it's in movies, it's in ads, it's in our, you know, our history books. I was sharing with my daughters as they were going through history, and the movie came out, 12 Years a Slave. I'm from Mississippi, they're studying in Georgia, and I'm like, y'all learning stuff I didn't even know. Because of course, your local persons are the ones that are on the school boards, that are on these institutional, you know, groups that determine what the children are taught. And so just seeing that about how the difference of, there was a more prominent role for African-American history in Georgia versus Mississippi, even though it still wasn't on point with what we need to be taught, tells you that's what you deal with when you're dealing with patients and with people in your communities. And it doesn't matter sometimes whether they're educated or not. Because if they don't have that experience or step outside of themselves or open to other experiences, then they still have that same small body of knowledge that looks at people in a same small way. And this affects everyone. So it's not per se just our, you know, Caucasian brothers and sisters or other ethnicities that may have this problem. We have this from persons in our own ethnicities that will look at us and feel like, hey, you can't be the doctor, or I don't want to trust my children or my care to you because white is right and you're less. And so I think definitely taking the bull by the horns, like you say, and addressing that. And I love that. So I hope anyone that sees this opportunity, sees this, this interview and this series that we have, take Dr. Elliott's example. I think that is phenomenal. Go ahead, let them have what they're asking for, whether it's, you know, another ethnicity or Caucasian person that's doing that and you as the boss. Hey, so let me show you this example of, you think this is the person who's in charge. Well, the person you think is in charge is actually answering to me, and I'm in charge. So that'll hopefully be an example and a lesson for them, because if a lot of them haven't seen the opportunity, haven't had the opportunity to see persons like ourselves in this role. We do have to acknowledge that. I know when I was a attending physician at Auburn University, very diverse school, you know, children, folks from all over the world, even international, right? And I had students there that were like, I've never seen a Black doctor. I've never seen a Black female physician. And you're thinking, wow, this is, you know, the 2000s, you know, 2010, 20, whatever. And they don't see it. And we know, of course, as being the quote unquote unicorns. If you look at the statistics for African Americans, persons of color being physicians in the United States, it's not a lot of us. So it is up to us on one hand, you know, to definitely try to educate and try to advocate and, you know, do those things and make sure that patients, community, and our children know. But at the same point, like Toko said, we can't take it upon ourselves to educate, in some cases, adults or teach them how to act. We can definitely stand our ground. We can make sure that we're not mistreated, and we want to make sure, of course, our children aren't mistreated. But still, it's only so much any one person can do. And to try to think of yourself, let me show you, you know, what you should do, shouldn't do. We can just say, hey, this is what I'm going to allow, and this will not be allowed. But I think that's an excellent example to use to let people know that, yeah, persons of color can have internalized racism as well and respond to us in some of the ways that persons of other ethnicities may. Dr. Shania, so a brief intro about yourself, my dear, and we were just answering what instances of racism do we have that we've experienced. So tell us a little about it.
Where to start?
I know. Unfortunately, it's not funny, but yes, ma'am. Go ahead.
But an honest conversation is always necessary around these topics. So my name is Dr. Siebels, and I am a maternal fetal medicine specialist in Columbus, Georgia. I'm originally from Central New Jersey. I grew up in a very diverse town in New Jersey. And quite frankly, even though my parents were born in the 40s, and my father was from the South, so had oftentimes lots of stories about racism, especially because both my parents, being Black, achieved PhD status in the 60s. And so they had a lot of stories in terms of their progression in life from that standpoint. So education was very huge in my household. For me, me and my siblings are interesting in that me and my sister will always say this. I remember being very, very young, third grade, and just always knowing I was the smartest kid in the class. And that's because that's what my parents instilled in me. My father, the only way that he was able to establish himself as equal of a human being was to achieve higher education. And so that was always a huge part of what we did. And so I remember just having those thoughts and those feelings when I was very, very young. And so that has always carried me through education. And so really, it wasn't until college that I really first experienced any sort of what we would call racism on any sort of level. Because again, I grew up in a very multicultural area. But when I went to college, I went to a PWI, I went to Rutgers University. And I decided to live on in a special interest section. It was for African Americans. And so our entire floor in our building was just African Americans, and the rest of the 3 floors in our building were mixed, mostly Caucasians. And we used to be called the nigger floor, and I had never, we were the 3rd floor. So, you would get on the elevator and people would hit the 3rd floor for you. They'd be like, oh, you're going in the nigger floor. Okay, you're 3rd floor. And I was just like, oh my gosh. And so I had never really been but at the same time, I had this group of friends that we became really close with. And so it was a very supportive environment nonetheless. But that was the first time I had ever really experienced any sort of overt, in your face sort of racism. Right. So, for me, when I got to residency and certainly being in any sort of surgical residency as an OBGYN, it's fairly competitive. And I went to a residency program in Southeast Michigan that was in a very heterogeneous area. It was nothing but Caucasian people. And I was only one of 2 Black people in our entire hospital my first year. And of course, they would always confuse the 2 of us and call us each other's names, even though she was an ophthalmology resident and I was clearly an OBGYN resident. They're very 2 different areas of the body. And we looked nothing alike. We looked nothing alike other than the fact that we were Black. My fellowship was a completely different story. And really until my fellowship, I feel like my circle of friends was always very multicultural. And in fellowship, that changed. And it changed significantly as my environment changed to one that was no longer supportive, and it was very hostile and aggressive. But my 3 years of fellowship was the worst time of my medical career, quite frankly. In my first year of my fellowship, there were times where I was going to leave. And I had to reach out to some mentors and some Black attendings in my hospital who told me, listen, you can start to bring up some of these issues that are going on in your fellowship, but you're not going to get to where you need to go in life, where you want to go in life. And so it's unfortunate that we as Black people sometimes have to make these decisions about, when to bring about or when to notify people that something is not correct in terms of racism, microaggressions, or overt either way. But I had to make a choice that I wasn't going to speak up or say anything. And I swallowed all of those things that were happening to me during my first year in fellowship. And holding on to that literally destroyed me over 3 years. And by the time I was done with fellowship, I was burnt out. I was mentally exhausted, and I was done. I was done. When I went to go interview, I wanted a community and an environment that looked like me. And that is one reason why I came to Columbus, Georgia, because when I came into this hospital here and I looked around, I said, who are all of these Black physicians? I was taken aback. I had never seen so many Black physicians in one hospital community. So I was thrown. I didn't even know Columbus, Georgia existed before I came for my interview, quite frankly. And so, and now I'm so happy. I'm taking care of myself, my well-being, the whole entire balance and everything. And I have a lot of support here in my community. So I think overall, we really need to acknowledge the pains that we have to go through in this process, especially for folks in medicine, because it's a very unique system that we have to navigate to be able to get to where we should be, where we want to be, and where we deserve to be, if you work hard and you put the time and effort in. But know how to navigate it well, because you can't always, you have to play the game right. You can't always start the revolution, as some people would call it, over everything that occurs. We have to learn how to respond to events that are happening around us in appropriate ways.
Here, but just to have that, whoo, and then also to be, like we discussed before, an experience Dr. Virgil had, to be so just left wide open and exposed and not protected and supported by your teammates, folks that are supposed to be. It's already a hurtful situation, but then that insult to injury is, you see I'm hurting, you see this isn't right, and you're like, you know what, suck it up, you'll be fine, just get through. And realizing that, no, you're not fine, you still have to deal with that, and still it's going to be loss of either physician lives or of your mental health, of your well-being, which is going to affect how you take care of yourself or your family or your community, and we can't ignore the repercussions of that.